Good morning. We had a wonderful discussion, and I do want to thank the group that attended our session. And our session was really an example of interprofessional collaboration between a School of Dental Medicine and also an interprofessional clinic that is at a community college in Illinois. So the innovation, though, that we really came up with as far as the overall innovation is actually community colleges because they are embedded in the community. As we've heard a lot today and yesterday, of the community. And if you think about a community college, they are of the community. The taxpayers pay for the community colleges. The Board of Trustees are from the community. And so much of the direction at a community college obviously is from those people within. Additionally, one of the things that was just mentioned is the fact of having people involved from the community. And I can tell you that with a particular clinic that we run, we do have community involvement, as well as with our mobile health unit. In all of the communities, we have a representative that helps us get that mobile unit to be a success to deliver health care. You know, one of our individuals that I love to talk about is Fern, who's 93 years old, and she makes sure that those people in that small community come to that mobile health unit. So also with community colleges, 48% of the individuals in this country are beginning their education at a community college, and also the majority of our beginning workforce is coming from community colleges. So I think that was the innovation that we really kind of came up with. Also the fact that community colleges and universities really need to collaborate. How can we do this? That is probably one of our biggest challenges with the scaling up, is that working together. You know, how do we do that, you know, regionally? You know, is it, you know, this is a certain number? So that was one of the big things that we did discuss. Additionally, we talked about some of the, I would say, challenges. We talked about what is the understanding and interpretation of IPE when it comes from the educational venue. For example, you know, just because students are may be in a class together, like all the health profession students are in A&P, is that really IPE? You know, how do you really practice it? So that was one of the things we talked about. Reimbursement issues, that's a big, big issue, especially in a clinic such as ours that we have that's open to the community. How can we be sustainable? And I'm happy to report that as a nurse managed center, we are sustainable. So that is a model that we could actually kind of look for. Turf battles, we still have turf battles, you know, when you're thinking about it. So that was another challenge that we talked about. One of the things we also discussed is that a lot of this work needs to come with buy-in from the administration, the presidents of the universities, the presidents of the community colleges, really very important. Faculty development, getting faculty on board with interprofessional education, educating them. Sustainability, I've already mentioned. Accreditation issues, that seems to be a big issue that was discussed a lot at our table. And one of the things with sustainability that many groups, people in the group talked about is the fact that we have to have return on investment. And I think that was really important. You know, we talk about a lot about education, but it was eloquently spoken about the return on investment. You know, you have to show that, for example, this clinic is keeping people from going to the ER. And if you can say to a politician or, you know, a hospital administrator or the community health people at the public health department, we saved, as Ruth said, this amount of money, how important that is. And that's what we really need to do. Also, the awareness of the existing model that we have. This model, as far as I know, we're the only community college in the country to have this kind of model. So how do we spread this out, and how can we actually make this model more aware? As far as value, community college as a model for community-based IPE, Lucinda said it well. She said, as a model for IPE, yes, yes, and yes. So I thought that was really important the way she had stated that. And finally, just some of the opportunities. We feel the opportunities are definitely here for universities and community colleges to work together because of the fact that so many of the health programs begin at the community college. And so that's kind of our brief overview. I know we wanted to keep it to a limited amount of time. So questions, or anybody from my group if they want to add something.